This is Bonnie Vandermeulen, Training Coordinator for Wisconsin Facets. On behalf of our entire Wisconsin Facets staff, I'd like to thank you for joining us today. Today's webinar is entitled Medicaid Made Easy, Understanding Medicaid for Children with Disabilities, and our presenter today is Barb Katz. Barb is the co-director of Family Voices of Wisconsin. She is a mom of 3 adult sons, and her middle son, Ben, taught her all she needed to know about Medicaid. She is eager to share her knowledge with other families so they can be the best advocates for their children. It is my great pleasure today to introduce to you Barb Katz. Barb?
Thanks, Bonnie. I appreciate it. And hi, everyone. Thanks for joining us this afternoon. I'm going to turn off my video because I get distracted looking at myself, and you'll see the slides. I'll turn my video on again. I just wanted to greet everyone who was joining. So, welcome to Medicaid Made Easy, Understanding Medicaid for Children with Disabilities. This online training was made by Family Voices of Wisconsin to answer your questions about Medicaid. Family Voices of Wisconsin is an affiliate of the National Family Voices. We serve as Wisconsin's family-to-family health information center, and we're also part of a statewide network serving children and youth with special health care needs, supported by Wisconsin's Title V program. Our work is focused in 3 areas. We develop easy to understand information for families through newsletters, fact sheets, and trainings. We provide family leadership opportunities and support, and we're involved in systems change and public policy initiatives on behalf of families who have children with disabilities and special health care needs. We partner with 5 regional centers that are part of the Children and Youth with Special Health Care Needs Network. Staff at the regional centers know about many resources in your community and can answer many of your questions. Often regional centers have family members of staff, and they're able to relate to many of your concerns. If they don't have an answer, they will find one for you. So let's talk about the information you'll need for a basic understanding of the Medicaid program. You'll learn about the program, how it's funded, and what it looks like in Wisconsin. This section answers questions that people who are new to Medicaid might have. I'll be pausing throughout this presentation to answer any questions, so please jot them down, and when I pause, Bonnie will help moderate those questions for us. So what is Medicaid? Medicaid provides health coverage to millions of Americans, including eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. Medicaid is administered by states according to federal requirements or rules. The program is funded jointly by states and federal government. And because both the federal government and the state of Wisconsin put money into Medicaid, they also put rules and regulations in, and that's why this program gets so complicated. Many people ask if there's a difference between Medicaid or Medicare, and yes, there is a difference. Medicare is for adults with permanent disabilities or over the age of 65 years. Medicaid, on the other hand, which is what we'll be talking about today, is a need-based healthcare program for people with low income, including pregnant women, families, children, and the elderly, as well as people with disabilities. Some children might have both Medicare and Medicaid. For example, children may get Medicare if their parents are deceased or retired. So what does Medicaid look like in Wisconsin? The goal, as we said, the goal of Medicaid is to provide basic health care services. In Wisconsin, the Medicaid program is managed by the Department of Health Services, and compared to other states, has a broad range of services with which we'll dig into in just a minute. People often ask if children can have both Medicaid and private insurance, because a lot of programs have this, both Medicaid and private insurance coverage for their children. Coordinating this coverage can be confusing and raising questions about how claims will be paid. The most important thing to know is that Medicaid is a payer of last resort. That means that all claims must be billed to private insurance first. If private insurance has denied payment of the claim or paid only some of the claim, then Medicaid will be billed. Medicaid can also be used to pay co-pays from private insurance and may pay for therapies and services that your private health plan won't cover. I just want to reiterate that if your child has both Medicaid and private insurance, it is essential for the service to be billed to private insurance first. If that does not happen, and if there is not a formal denial from private insurance, Medicaid will not pay that bill. They will only pay if there is a official denial. So I will pause before we go into what's covered to see if there are any questions.
We don't have any questions at this time, Barb.
Okay, thanks, Bonnie. So let's talk about what's covered. Your child has a federal Forward Health or Medicaid card. Now what? You may not know what the card is used for, so we're going to go over the basics, including the services and supports that may be covered to keep your child living safely at home. In a few minutes, we'll be talking about different eligibility doorways, but it doesn't matter which door is used to get Medicaid. The Medicaid card benefits are all the same. Medicaid card benefits are the goods and services that are covered by showing your Forward Health card. And this is an example of what a Forward Health card looks like. When your child's Forward Health Medicaid card arrives in the mail, put it in your wallet and keep it with you at all times. Then show the card at each of your child's appointments and at the pharmacy for prescriptions. At appointments, providers will ask to scan your card to make sure that you or your child are still covered. Also, remember to ask the provider if the Medicaid card will cover any new therapies or medications that providers recommend for your child. If it's not, providers will likely work with you to find alternatives that are covered or try to get approval for their recommendations. So this is a huge list of mandatory services in Wisconsin's state Medicaid plan. The federal government only requires that each state offers the services in red for the Medicaid plan. Clearly, Wisconsin offers more than is federally required. At any time, though, the state legislature can change the Wisconsin state Medicaid plan. So it's important to stay informed about legislative activity regarding the services that your family uses. So let's dig into some of these, and we'll be talking about some of these in depth. But I do want to point out that Medicaid does cover dental services. It does cover something called EPSDT or health check, which includes autism treatment services. And EPSDT stands for early periodic screening, diagnosis, and treatment, which means when we talk about the health check, that there are things that might be medically necessary for your child that you do not see on this Medicaid state plan, but may be covered because of your child's condition. We see on this list that there are things such as uh, home and community-based service waivers. That is a 1, 2, 3, 4, the sixth bullet on the left-hand column. That includes the Children's Long-Term Support Program, and we'll be going into that home and community-based waiver program later in this presentation. You will also see things like medications, medical supplies and equipment, mental health services, optometry or eye services, personal care services, different therapies such as physical and occupational therapy, speech, hearing, and language therapy, skilled nursing home, and transportation to obtain medical care. So the Wisconsin State Medicaid plan is extremely comprehensive and is a great source of healthcare payment for different services that your children with disabilities may need. So let's dig in a little bit more and talk about what the Medicaid card can pay for. If your child, as mentioned earlier, if your child is eligible for Medicaid in Wisconsin, he or she will be given a forward health card. This is an example of the white card on the left side of the screen. This card can be used for routine medical services. It can also pay for things that a child with a disability or special health care need may need to continue living at home. This includes items like diapers for children over the age of 4, over-the-counter medications, and other services due to what's called medical necessity. The Medicaid card can also pay for personal care services to help your child with activities of daily living in your home. Your regional center can help you find a home health care agency in your community to provide those personal care services. So let's talk about Health Check Other Services. In Wisconsin, EPSDT, which we noted before was a federal benefit, is called Health Check and Health Check Other Services. Health Check Other Services is a useful way for your child with their Medicaid coverage to access services and supports like mental health services. This includes residential and day treatment programs when there aren't other coverage choices. To get these services, your child's doctor will need to do an annual health check exam, which is essentially your child's annual well child exam, or the screening that shows that mental health and behavioral health services are medically necessary. Medicaid, so talking more specifically about these mental health services that Medicaid can cover, they can cover behavioral health and substance abuse related supports and services. The programs supported by Medicaid are county-based, so there can be a lot of variation in different parts of Wisconsin. The programs like coordinated service teams are known as wraparound programs, and comprehensive community services is another program that's meant for children who have more complex needs. If you feel that your child needs this level of care, the best place to get started is to call your county's Department of Health Services to learn how to get in what's called an intake started. Let's talk for now about non-emergency medical transportation. The provider for this changed on November 1st. So it used to be MTM. It is now VAO. So if your child has a Medicaid card and you need help getting to his or her medical appointments, you can contact VAO, the new provider, 2 days before the appointment to set up a ride. VAO services are only meant to be used if you have no other way to get to your child's appointment. So the person scheduling the ride will ask about this. This is a point where your advocacy will really need to kick in. Don't be afraid to let them know if it's hard for family or friends to drive you and your child. And if you don't have an automobile available, don't be afraid to let them know either. You really need to, this is a Medicaid benefit, and you will really need to use your advocacy skills to make sure that you have access to this benefit. You might want to allow extra time, as much as 2 weeks, if this is your first time using the service, because VAO will have a process for onboarding you and your child into their service, and it might take time. So if this is your first time using VAO, which I would assume for most listeners it is, since this provider just started working with Medicaid, with Wisconsin Medicaid on November 1st, to allow more than the 2 days, allow extra time. You might be asked for a prior authorization or extra scheduling time for more rural communities. VAO, like many other service providers in our state, is facing a workforce shortage, and as such might need also additional time to ensure that a driver is available at the time that is coordinated with your child's appointment. Family Voices of Wisconsin has a Medicaid a non-emergency transportation fact sheet that is available on our website that will give you this information and the process in more detail. And our website is, and Bonnie, I don't know if you are able to pop that into the if there's a chat box here, but if our website is familyvoiceswi.org. So that is FAMILYVOICESWI.org. Once you get to our website, you can navigate to the Learn tab at the top. That will take you to recorded trainings that we have, and you can navigate to the Resources tab that's next to it, also on the top, and that will take you to all of our fact sheets. Our fact sheets are in English and Spanish and are easily downloadable from our website.
Excuse me, Barb, if you want to just repeat that once again, I'm writing it in the chat, familyvoices.org, correct?
FamilyVoicesWI.org.
Okay.
So FAMILYVOICESWI.org.
Got it, thanks.
Great, thanks, Bonnie. So, diapers and incontinence supplies are also covered under Medicaid. Some children use diapers or other incontinence supplies for a longer time than typically developing children, and some children actually use them throughout their lives. The medical term for diapers is incontinence supplies. Wisconsin Medicaid will pay for diapers and other incontinence supplies for children ages 4 and older. So once a child turns 4, Wisconsin Medicaid will start paying for these supplies. And these supplies include briefs, which are diapers that open on each side, pull up and pull on type diapers. Incontinence supplies also include disposable underpads, liners, disposable gloves, catheters, skin barrier swabs, lubricants, and other related supplies. To have these supplies covered by Wisconsin Medicaid, you must order them through J&B Medical Supply. And J&B will also deliver the supplies to your home every month. Again, working with J&B is another time when your advocacy skills really come into handy. come in handy. One thing to know is that J&B does not, and Medicaid does not pay for disposable wipes. So that's a question that families often have. Family Voices does have another fact sheet specifically on diapers and incontinence supplies, because there are many families who have questions about getting these through J&B. Where your advocacy skills will come in is asking for samples and working with J&B if the product that they recommend for your child is not an effective product. And so families who, the fact sheet has some great tips from families who have worked with J&B and tips and strategies that they use to make the process more streamlined and more effective to make sure that they get what their children need.
Excuse me, Barb, but we do have a question that goes back to transportation. Would you like to take that now?
Yes. Yep.
Okay. The questioner is asking, with this new service, the Vagos service, is this something that's a shared ride, or do they have to plan for extra time because there'll be multiple people in the car? Will it be a cab or a private person driving? Those were some of the questions.
Yep, I don't have the answer to that. I believe it will be similar to MTM. And so I do know that the Department of Health Services has some questions and answers and frequently answered questions on their website. And so you might want to go to their website and look up emergency medical transportation. So the website you would go to is dhs.wisconsin, spelled out, .gov, and that will get you to the landing page, the main page for the Wisconsin Department of Health Services. Once you get there, on the top, they have sort of an alphabet, they have the alphabet, and you can click on N for non-emergency medical transportation, and then just sort of navigate through that, and it will get you to the new page that has information about VAO, about how that works. So I would think that there is a possibility of shared rides in more densely populated areas. And there is also the possibility that because of the demand on drivers, again, you might need to allow some extra time to get to and from an appointment.
Okay, thank you for that. I do have a question that goes back to something that you said before. Would you like me to share that at this time?
Yep, Bonnie, please.
Okay, so it goes back to the discussion of the list that you had, and one of the things on your list was home health services or nursing services. And so if a person has never used these services before because they've always depended on family members or whatever to do it, but the family is going to be gone at that time,
Yes.
would a visiting nurse be able to come in and like administer eye drops or do some of the medical procedures that would be necessary during the time that the family will be gone?
So that is something that will likely need to be have a prior authorization. And so is the person talking about an adult or a child?
This is an adult with disabilities, but living on their own,
All right, so what they would need to do is contact their Aging and Disability Resource Center, the ADRC, to get a list of nursing services that would be able to serve them. Then they would need to contact that nursing agency and ask the question of them specifically, and then what the process is.
Okay, thank you.
And the other thing is that they might need an alternative to that is that they might want to contact their primary care physician, and their primary care physician's office might have a similar list of nursing care agencies that would support them in their home. And that physician might need to write essentially a prescription saying that this is a medically necessary service. And Medicaid will only provide medically necessary services. So I would actually suggest that they contact their primary care physician first. And then if the primary care physician says that they don't have a list of available nursing agencies, then they would contact the Aging and Disability Resource Center. But regardless, they would still need a prescription from their physician, and likely a prior authorization will need to be followed. And we will talk about prior authorizations at the end of this training.
Okay, thank you very much.
You're welcome. Are there other questions, Bonnie?
Not at this time.
Okay, then let's get back. Whoops, and I went the totally wrong way. Sorry, guys. My technological skills get confused. All right, so let's talk about personal care services, because that's another Medicaid service. So personal care services allow a person to live well and safely at home. Personal care services include tasks like feeding, toileting, bathing, dressing, light housekeeping, laundry, and meal preparation. And there are, of course, Medicaid rules for using personal care services. For example, if the child or adult, because personal care services are offered throughout a person's lifespan, the child or adult must have access to Medicaid, have a forward health card, and need these services for medical reasons. Medicaid must also approve the agency and your family's care plan before services begin for your child. So prior authorizations are also utilized and necessary for personal care services before they're offered. If you think that personal care would be helpful, similarly to home nursing, contact your child's primary care provider or their children's long-term support and service coordinator to find available agencies in your area. The agency then, once it's identified, will use an in-home screening tool to decide how these services are necessary for your child living in the context of their home. So some advocacy tips along with personal care services. We know that very young children, those like 1 and 2 and maybe even 3, need a lot of assistance for these activities of daily living, right? Some of them, obviously, babies need total assistance. As typically developing children get older and develop further, their skills increase. For children with disabilities or special health care needs, they may always need assistance or total assistance with these activities of daily living. When personal care agencies come in and do that assessment or that screening tool, they will look at the differential between a typically developing child and a child and your child who has disabilities, to look at, is there a significant enough difference between the assistance that your child with disability needs as opposed to the assistance that a typically developing child needs. And it is that differential that will say whether or not a very young child is eligible for personal care services. As a child ages, and becomes 4, 5, 6, and older, that differential is likely to become wider and wider. And so eligibility may be more clear cut for an older child than for a very young child. But if your child has significant needs, if there are other children, young children in the household, it's still suggested that you go through this assessment to see if, in fact, a very young child would also be eligible for personal care services. So let's now pivot and talk a little bit about long-term support programs. So long-term support programs are known as home and community-based waivers. The Medicaid waiver word is a part of the Medicaid law that lets the federal government essentially waive the rules that are a normal part of the Medicaid program. By waiving these federal rules, states can offer long-term support programs that let families care for their children at home and participate in their communities. And then for adults, it gives adults a voice in directing their own lives. So for children, the home and community-based waiver is called the Children's Long-Term Support Program, or CLTS. For adults, there are several programs. Family Care and IRIS are the two most common programs. Partnership is another program which is not available in all counties, but does include a managed care program like Family Care, and also Medicaid card services, which are known as primary and acute services. So that's all sort of packaged with one set of providers. So children's long-term support programs are available until through the 18th year. However, when for kids in transition or transitioning, it is suggested that at the beginning part of their 18th year, they transition into an adult long-term care program. The reason why the children's program covers kids till they turn 19 is because sometimes there is a lag time in disenrolling from children's programs and enrolling in adult programs, and they Medicaid wants to make sure that people don't have a lapse in coverage. So let's talk about the Children's Long-Term Support Program. And to make sure that you all are really clear on what we mean when we talk about long-term supports. Long-term supports are those programs and services that help a person live an independent life in their community. So these came about as a alternative to when people with significant disabilities used to be institutionalized. Some examples of things that the home and community-based waiver, the CLTS waiver, will pay for will include adaptive aids, home modifications, parent training and education, peer support for the child, respite for the family caregivers, specialized equipment, and vehicle modifications. This is not an exhaustive list. This is just a list of some of the more popular supports and services that the Children's Waiver pays for. Now, families often get confused between respite care and personal care. And so your family may choose respite care as part of their children's long-term support programs. You might have heard of both of these, respite care and personal care services, and thought that they were the same thing, but the programs are in fact very different from one another. The main difference is that respite care is meant to give the parent or the family caregiver time off from their caregiving duties to unwind and to do other things, while personal care is like having a helper in your home with you to do some of your child's daily living activities. Some families, some children might qualify for both programs. It totally depends on their care needs. Personal care also must be provided in the home, and it's paid for as a Medicaid card service. Respite care um, can be provided at home in the community, and again, it's time off. And it also, if the child has experiences respite care outside of the home, it can give them an opportunity to be more involved with their community and take advantage of what their community has to offer with a non-parent caregiver along with them for health and safety. I'll stop and see if there's any questions for about that, because it is very confusing. And so this would be a good time if anyone has any questions about what Medicaid covers, what either what the card covers or what is included in the Children's Long-Term Support Waiver before we go on to eligibility and enrollment.
So we do have a question, and it's one where this is a person with disabilities who is living independently with help from their family. And the question is, a person is having a lot of trouble with doing like cooking chores, for example, and that their hands are so impaired that it's really dangerous for them to use a stove, for example.
Uh-huh.
Who do you call to get like cooking help, for example, when a family can't provide that?
So that would be a personal care service, and that would be a great time to call the Aging and Disability Resource Center in that person's county. That can readily be found either online or perhaps, you know, Bonnie afterwards, Wisconsin Facets could provide that support to find that. But the Aging and Disability Resource Center will have a list of personal care agencies that serve different communities. Aging and Disability Resource Centers are set up by county. Bonnie, you could perhaps, while I'm talking, you might be able to find the general ADRC page on the Department of Health Services website, which will allow people to search for the one that serves them in their county. Anyway, ADRCs have listings of personal care agencies, so it would be a matter of contacting a personal care agency, having them come to your home to do an assessment of you and your needs. And then if you're found eligible, talk through their process of developing a plan for your needs, which absolutely can involve cooking, and it could involve other things for assistance if you're eligible, like grocery shopping or light housekeeping. And is really a tremendous service that is paid for by Medicaid.
Okay, we do have another question that just came in here, and let me have that for you. It says, if your child is total care or if family has multiple children, how can there be a 40-hour per week limit? How can a caregiver challenge this with IRIS?
Okay, so that's a very complicated answer. IRIS, I believe, IRIS, which is the long-term support one of the long-term support programs for adults, for adult children adults over the age of 18. A number of years ago, they put a rule into place saying that no caregiver can work more than 40 hours a week. And essentially, I believe that that rule was put into place because of to try and limit caregiver burnout, essentially. So, because of 40 hours a week is what is regarded as a typical work week. IRIS participants struggle with this because of the workforce shortage and because there aren't always available people to work in the home. And so the best place to start is to start talking with your IRIS consultant and to talk about workforce shortages and to brainstorm with them solutions to that. If there are no appropriate solutions to be found, you can talk with the IRIS consultant to see if there can be a temporary exemption for the 40-hour-a-week limit. If your IRIS consultant cannot assist you with that, you can contact an agency called Disability Rights Wisconsin. And Bonnie, perhaps you can find their contact information and pop that into the chat box.
Sure.
Disability Rights thank you. Disability Rights Wisconsin is the protection and advocacy organization for people with disabilities. And they have attorneys and advocates on staff. Because of capacity, they cannot take on every case that is presented to them, but might have some advocacy tips that they can offer. And so they would be a good place to connect.
Okay, and that's all I have right now, Barb.
All right, sounds good. Thanks, Bonnie. All right, let's talk about eligibility and enrollment. We've talked about the different doorways. So now we're going to explain each of these doorways so you know which program is right for your child. This building shows 7 doorways that children with disabilities or special needs may use to access Medicaid in Wisconsin. So we talked about the Children's Long-Term Support Program, CLTS. Other names for Medicaid include Title 19, CCS is a mental health program that we talked about, Badger Care Plus, SSI, Supplemental Security Income, and Katie Beckett and Medical Assistance are the other names of different entry points into Medicaid. Regardless of the name, the doorways all lead to the same Medicaid benefits. So there's 3 different eligibility programs for children, again, that all access the same Medicaid system. Your child can enter the disability doorway with programs like Katie Beckett, which only considers the child's income, through the income doorway with programs like Badger Care Plus that looks at the whole family's income and does not need to have a disability determination. Or your child can receive Medicaid due to both their disability and family income through the SSI, the Supplemental Security Income doorway. SSI is not a Medicaid program, but it gives you automatic eligibility for Medicaid in Wisconsin. There's one rule that's the same for no matter how you access Medicaid, and that is that proof of United States citizenship is required for all Medicaid programs. So let's dig into each of these 3 a little bit more. Badger Care Plus is a healthcare program for low-income Wisconsin residents. Children, pregnant women, and adults, including those that are 18 to 25 who were in foster care when they turned 18 can apply. Families can apply any online at any time at accesswi.gov or by calling 800-362-3002. Just want to make a comment that these slides are available for download in the handout section of this webinar. So please feel free to download these slides to make sure that you have all of these websites and phone numbers. If you've applied in the past and did not meet program rules, you might apply again since some of these rules have changed. And if you are enrolled in Medicaid through a Badger Care Plus HMO, you'll get a packet that explains your HMO or your health maintenance organization, the enrollment process, and contact information. You'll also have 90 days after you've enrolled to change your HMO, whether you chose it, or whether it was chosen for you. Supplemental Security Income, or SSI, is another doorway to Medicaid. It also includes a monthly cash benefit from those who are eligible. SSI uses two standards to decide a child's eligibility. First, the child's disability must be severe, reaching an institutional level of care. And second, the family's income must fall below the limits of a standard equation. And both standards must be met for a child to be eligible for SSI. Looking at the Katie Beckett program, the Katie Beckett program is one of the doorways to Medicaid for children under 19 years old whose disability meets the requirements of the Disability Determination Bureau and also requires an institutional level of care. A standard evaluation called the functional screen tool is used to see if a child meets that institutional level of care. This means that a child may have a disability, but not, and experience that a delay that's high enough to qualify. Eligibility, now the functional screen might find that a child does have a disability, but doesn't meet that criteria for an institutional level of care. Eligibility to Medicaid through Katie Beckett is the only Medicaid program that looks at the child's income and not the family's income or assets. This is a situation too where children might be covered under private insurance and have access to Medicaid. Long-term support programs, the waiver program has an additional disability determination, even though the standards are similar to the Katie Beckett Medicaid program. To be eligible for long-term supports, your child must be living at home with their family and meet what's called the institutional level of care, and have a diagnosis of a physical disability, a developmental or intellectual disability, or a severe mental health disability. Within the long-term support program, a fee might also be charged to the family, depending on the family's income and depending on the child's level of care, supports, and services. So let's talk a little bit about that functional screen, the Children's Long-Term Support Functional Screen. This is a computerized tool that's used to decide if your child meets the guidelines for Medicaid programs and long-term supports. It does this based on the amount of help that a child needs for self-care. So just a few other things that you need to know about the functional screen. You can appeal the decision if your child doesn't at that point in time meet the eligibility standards. Secondly, your child can repeat the functional screen again at a later date. And as we talked about earlier, with personal care, this functional screen measures child's eligibility against the abilities of typically developing peers. An older child then may gain eligibility quicker because the ability gap widens as children get older. The third thing to know is that you have the right to ask for a functional screen for your child at any time, even though the screener might think without doing the screen that your child will not qualify. You have that right to ask for a question, for the screen to happen. And so again, that's another advocacy point. You know, the thing when we think about the functional screen is that when we talk about our children, we often give them, talk about them in ways where we stress their assets, and we talk about them in a rosy way and may not talk about them as realistically as possible. When you're talking with the person doing the functional screen, it's important to be more realistic and a little less rosy. That means resisting the urge to brag about your kids, even though it's what we do. Instead, it's best to imagine that you're taking a great trip and you'll be gone for a month. What type of instructions would you want to leave for a person caring for your child, especially someone who doesn't know them, to make sure that they're safe and healthy? Would you be rosy or would you be realistic? Likely you will be realistic, because it's that type of detailed, realistic description that you will need to provide to a potential caregiver, and that you also need to provide when you're doing the functional screen evaluation with the screener. This is to assure that they get the most realistic sense of what your child's needs are.
Barb, I have another question for you.
You bet.
If the benefits are the same, what is the advantage of like a pathway of entry versus another?
So it's not necessarily an advantage, it's more of what your family composition looks like. For Badger Care and for SSI, a family needs to have a lower level of annual income and lower assets in order to qualify. In order to qualify for Katie Beckett and the child, okay, right, so they have to have a lower level of assets. In Katie Beckett, a family with a higher level of assets can apply. However, it is also a higher bar of disability determination for the Katie Beckett program. Social Security, you need to have, the family needs to have, the child needs to meet the eligibility criteria for Social Security, as well as having a low income. For Badger Care, a child does not need to meet a level of disability at all, and the only determination is made on the family's income. Again, let's remember that Medicaid is a program, a medical insurance program that is designed for people of low income. And so that's why those income thresholds are there. Katie Beckett is an exception to that, because as kids with very significant disabilities moved out of institutions and received more and more of their care at home, their Medicaid realized that kids with significant disabilities may live in the context of families that have higher income, and in order to support them, families still need access to supports and services that Medicaid provides, and that's why the Katie Beckett program came into existence. So it really is not that one doorway is better than another. It really is what is the doorway that's most appropriate for your family situation. And figuring that out, this is another example of where the regional centers for children and youth with special health care needs can work with families on a one-to-one basis and help figure out what the best doorway is.
Okay, that's all I have for now, and we have about 5 minutes left.
Okay, great, thanks. So let's quickly wrap this up by talking about prior authorizations. But this slide gives you information on applying for Medicaid in general, and this slide gives you information on how to connect with the Children's Long-Term Support Program. So I've used the term prior authorization, and for many services through Medicaid, a prior authorization needed. This is also true for private insurance. Private authorizations typically take place behind the scenes unless there's a denial or a change to their request. That's the time that parents hear about it. I just want to briefly explain how the process happens and what you can do if you get a denial. We know that getting a denied a service that our children need is very upsetting. So we want to do all we can to avoid that situation. So who approves a prior authorization for Medicaid? First of all, know that it's a very common process. And a prior authorization is a written request between either your private insurer or Medicaid and the health provider, and is the health provider asking to explain why the service is medically necessary before payment can be improved. Healthcare providers are used to giving this information. As I said, it's quite common. When Medicaid or private insurance has all of the prior authorization information, a staff member will review it. The service will then be denied or approved with specific details like the time period or the number of services to be covered. You've heard me talk about medical necessity. It is a set of rules or guidelines used by staff at the Department of Health Services to make decisions about prior authorization. This definition is set by the federal government. States are allowed to add to the definitions as long as they don't contradict the federal government or not more restrictive than the federal government's. Wisconsin, like most states, has made its own definition of medical necessity. It's the roadmap that Medicaid staff uses when deciding if a treatment or therapy is necessary for your child. And again, the definition of medical necessity can be found on the Department of Health Services website. Releases of information will need to be signed to let communication start between the healthcare provider and Medicaid. It's important to avoid what is called a duplication of services. So Medicaid will often ask for a prior authorization for a service to make sure that there isn't a duplication or overlap of the services. Duplication may happen because a child's medical team is billing Medicaid for a service that's similar to a service that your child receives at school. The educational and medical goals must be different to have the prior authorization approved. Remember, school IEP goals must be educationally necessary, and community therapy goals must be medically necessary. It's helpful to share your child's IEP with their community treatment team to avoid any overlap, and often Medicaid will ask to see the child's IEP. Finally, sometimes there are denials, and it turns out that that might not be the final decision. You can appeal a decision by requesting a fair hearing from the state. A fair hearing is fairly simple, and it's often done as a phone meeting, and you're allowed to have someone present to support you. The important thing to remember is to focus your appeal only on the reason for the denial and to provide new or additional information that supports your appeal. So we talked about a lot today. There are a lot of resources and people who can help you as you go through this Medicaid process. And I would encourage you to download the slides so you have that, and to go to the Family Voices website so that you can look at our fact sheets that will help you answer more questions. So thank you very much for participating in this webinar, and thanks to Wisconsin Facets for organizing this.
Barb, I do have another question for you if you
Yes,
don't mind taking it. The
sure.
last question that we have written here is, how can a family move from SSI to Katie Beckett the easiest? Is that done?
Okay, so the easiest way for that to be done is to call your county and just ask for a functional screen to be done on your child.
Okay, thank you. And I did put in that information that you requested in the chat box for everybody to have to access some of the other information that you talked about. So I'd like to also thank everybody for participating today. Thank you, Barb. This has been wonderful. It's been a great primer for everybody to know about Medicaid, and the questions that were asked, I think, were just super ones. So thank you again for your expertise and for your presentation today.
My pleasure. Take care, everybody. Thank you.
And this concludes our webinar for today. We'd like to thank everyone for joining us. Please be reminded that Wisconsin Facets has over 100 scheduled webinars and trainings. And please check out our website calendar and register for any of the upcoming trainings that may be of interest to you. Also, please watch for the short evaluation coming your way after today's live presentation. Again, thank you, Barb. Thank you, everybody, for joining us. And everybody be safe and have a great rest of your day. Bye-bye, everybody.